Not everybody's into the idea of wearing a mask, so 7 News anchor Diane Lee looked at the latest research on face coverings and the potential economic impact if people don't wear them.
The countries that have been most successful in lowering the spread of COVID-19 have one thing in common: mask wearing. But here at home,
I do not think that it should be mandated to wear a mask.
it depends who you ask.
If it's a small thing that we can do to help others, I think wearing a mask is the right thing to do.
Over the last 2 weeks, our numbers of positive cases have definitely gone up.
Dr. Christian Montagano at Emergency MD urges people to look at the science. He says masks catch not just the larger droplets from coughing and sneezing, but the tinier particles called aerosols that come from talking and breathing, which are often more worrisome because they linger in the air for hours.
They're hanging out much longer, especially within a confined space. You're in an office building with air conditioning constantly circulating, that these particles are hanging around a lot longer and, causing the risk of infection to go up.
That's why some of the upstate's largest employers, like Michelin, require mask wearing, social distancing, and temperature checks for all employees.
Someone arrives at the building, we ask if they've had any of these certain symptoms.
Mark Patterson, the head of environmental health and safety for the company, says he's alarmed by the rising COVID-19 rates in South Carolina. And with Greenville being a hot spot, he's urging everyone to make change, if not for your health, for the economy.
Beyond the health, if it were to continue to spread and have an impact on manufacturing as a whole, if you look at manufacturing in South Carolina, it's almost 17% of the economic output. So there's a significant percentage of our economy that could be impacted if we're not vigilant in the communities and bring it into the manufacturing sites, not just Michelin, but all of them.
In the beginning of the pandemic, surgical masks were scarce, but nowadays you can find these breathable, disposable ones pretty much anywhere. This pack of 50 for less than $30. And with the increased supply, you won't be shortchanging healthcare professionals.
Surgical masks also have a slight static charge that attracts small particles, making them even more effective. And while we should continue to save the N95s for medical professionals, even cloth masks can be nearly 70% effective in blocking particles you breathe in, which means even if you do get COVID-19, reducing the amount of exposure could lead to a milder case or no symptoms at all. In Greenville, Diane Lee, 7 News.